Hello guys, welcome back to Medico. So we'll be discussing about the Neetpg anatomy PYQs in this video and moving on to the first year, that is 2024, and question number 1. A tumor compresses structures passing through the superior orbital fissure. Which sensation is most likely affected? So here I've provided a diagram of the skull with all of the openings present in the skull, and the answer to this is sensation in the anterior scalp and the dorsum of the nose, because the ophthalmic nerve, which passes through the superior orbital fissure and supplies the sensory fibers to the scalp, upper eyelid and the dorsum of the nose, is affected here. And also nasopharynx, nasal mucosa, they're supplied by the V2, that is the maxillary division of the trigeminal nerve. V1, which is the ophthalmic nerve, is the first division of the trigeminal nerve, and the second division, the maxillary nerve, exits via the foramen rotundum, and that is also marked in that diagram. And the next one, the sensation of the chin is mediated by the mandibular nerve, which is the third division from the trigeminal nerve, which exit through the foramen ovale. So please go through the diagrams and the structures passing through each of these openings, because that is one favorite question which keeps repeating in anatomy in most of the years. Not most of the years, in like almost every year itself it has come. And so please check out on all the structures passing through. You can use mnemonics. It will be available in all of the revision platforms. Please go through that. Next question, which tongue papillae lacks taste buds? So answer is filiform. And recently the tongue papillae is a question which keeps coming up. So regarding filiform, in this question you can see, and the circumvallate papillae image was given in a previous year, and again related tongue papillae questions are coming up. So this is a potential topic. Please don't forget to go through this. Next one, which nerve mediates the gag reflex? Answer is glossopharyngeal forms the afferent and vagus forms the efferent. So all the superficial and the deep reflexes are very, very important. Please go through them. The afferent nerves and efferent nerves all are very important. Please go through them. Anatomy questions are very limited and from specific topics. So you know what is the previous year topic very easily from anatomy, and questions keep repeating from those areas itself in anatomy almost every time. So please go through them. Next, which artery is used for hemodialysis and lies behind the medial malleolus? So answer is posterior tibial artery. This every year 1-2 questions usually come from the upper limb or the lower limb blood supply or nerve supply. So this is one question which came in 2024 from that part. Next one, what is the outer covering of an omphalocele? This is relatively an easy question and a question which you should not miss out, because most of the students, like 90% of the students who are attempting Neetpg, will be attempting this answer correctly. And so if at all you make this one wrong, then you will be lacking behind in the competition. So don't make a chance for that. So here the answer is amnion, and two similar things are omphalocele and gastroglysis. So in gastroglysis there won't be a covering and the peritoneum is internal, whereas in omphalocele it's because of the failure of the midgut herniation reduction by the 10th week, and it is covered by amnion. Next question, transitional epithelium is found in which structure? So this answer is ureter, and transitional epithelium is also seen in mostly seen in urinary organs like ureter, bladder, etc. Next one, a patient has sensory loss in lateral 3.5 digits and thenar atrophy. Which nerve is injured? Answer is high median nerve. So this is a little tricky question. It looks simple, but you need to know the anatomy little in detail to answer this question correctly. High median nerve injury affects the sensation of the lateral palm and the thenar muscles, and the flexor pollicis longus weakness, which is the forearm muscle, rules out the carpal tunnel injury here. And next one, inability to make an OK sign indicates injury to which muscle? So again, the important nerves of the upper limb, like the median nerve, radial nerve, and their innervations and the muscle innervated are very important. These are questions related to that. So OK sign inability is seen in abductor pollicis brevis injury, and Also, the nerve supply of all of these are very important. Anterior introitious nerve is the nerve which is supplying abductor pollicis brevis. Next one, which nerve pierces pectoralis minor? Answer is medial pectoral nerve. So this pierces the pectoralis minor and to supply it, and also the major. And lateral pectoral nerve supplies the pectoralis major via the clavipectoral fascia. Next question, inversion weakness highlights which tendon behind the medial malleolus? So answer is tibialis posterior, because inversion is by tibialis posterior and it lies behind the medial malleolus. Next question, a patient presents with sciatica and tenderness in the hamstring muscle. Which nerve supplies the hybrid muscle that will be spared in this condition? So answer is obturator nerve, because sciatica involves a rotation or compression of the sciatic nerve and it is composed of the tibial and the common peroneal nerves. It typically affects the posterior thigh, leg and the foot. So hamstring muscles are supplied by the tibial nerve, which is a branch of the sciatic nerve, and the adductor magnus, which is a hybrid muscle. It has two parts. So the adductor part is innervated by obturator nerve and the hamstring part is innervated by the tibial nerve. Since the obturator nerve is not derived from the sciatic nerve, the adductor part will be spared in sciatica. Now moving on to Neetpg 2023 PYQs. A defect in which of the following forms the structure marked below? So the structure marked below is deep inguinal ring. Is the deep inguinal ring which is marked, and it is developing from fascia transversalis. So the derivatives from derivatives of superficial inguinal ring is also very important. The muscles which are related to the inguinal canal is also very important. The boundaries are very important. Please go through all of them. Next, a student had his jaw locked while yawning. Which of the following muscles is attached to the articular disc of the Fmge? Answer is lateral pterygoid. So lateral pterygoid, a lot of questions keep coming up regarding lateral pterygoid, because it is the only muscle which helps in opening of the mouth. So all the others have they will help in elevation of the mandible. The only muscle which helps in depression is lateral pterygoid. Next question, identify the structure in the following histological image. So this is an image of a glomerulus. Every year one histological image will be coming up. So histological image, please go through them. They are quite easy and they'll fetch you good marks. Next, injury at which level of the marked site causes failure of dorsiflexion? So this again regarding the nerve supply of upper limb or lower limb, every year 1 or 2 questions come. So here the answer is it's the common peroneal nerve, and site 3, which corresponds to the neck of the fibula. When an injury occurs at that site, it leads to failure of dorsiflexion. Next one, a defect in which of the following aortic arches causes the defect in the image shown below? So here you can see that there is a patent ductus arteriosus formed, and that is because of defect in the 6th left arch. So I've provided a table with the aortic arches and the arterial structures. So all of this are very important, and sometimes tricky question can come up from this. Please go through them. It's easy to remember. Please read, and it's a very important topic. Next, which of the following structures develops from the structure marked in yellow? So structure marked yellow is the allantois, and it gives rise to the urachus, which becomes the median umbilical ligament later on. So median umbilical ligament, as I've told, it is from the umbilical artery, and ligamentum teres is from the left umbilical vein. So don't get confused between median umbilical ligament and the medial umbilical ligament. They both are different things. Next, Meckel's diverticulum, it is because of the persistence of the vitello-intestinal duct. So Meckel's diverticulum is again a favorite question. Regarding surgery also, it's an important topic. Next, a patient with abdominal pain, jaundice and portal hypertension exhibits. Answer is esophageal veins and left gastric veins. So the other features of portal hypertension also you need to be knowing, like the caput medusa, which are the periumbilical veins, the superior rectal veins which get involved and leading to rectal varices. So all of these you need to have an idea, and which vessels, which veins are affected in each of these conditions. Next, a patient with swelling under the left ear lobe and pain likely has involvement of which structure? So answer is greater auricular nerve. Again, the nerve supply of the ear is very important. Of the EAC is also very important. Please go through them. Moving on to Neetpg of PYQs of 2022. The structure marked in the image below gives rise to which of the following? So here it gives rise to falciform ligament, and because it connects, the ligaments are not very clear in this image, but please go through them. The linorenal ligament, the falciform ligament, the gastrosplenic ligament, and the gastrophrenic ligament, they are very, very important. So please go through them. And yes, now moving on to the next one. A patient underwent surgery for varicose vein and now complains of sensory loss over the medial aspect of the leg and the foot. Which nerve is likely injured? So the answer is saphenous nerve, because it provides a sensory innervation to the medial leg and the foot. Next question, identify the cartilage from the image given below. So here it is white fibrocartilage because it contains dense type 1 collagen bundles and also chondrocytes which are arranged in rows, and there is no perichondrium visible. So different types of cartilage and their features and how to identify them in the image is an important thing. Please go through them. And next, identify the structure shown in the histology image. This is an image of the pancreatic islet cells. Previously, we had seen the image of glomerulus. So histology, every time one question will come. Please go through that. Now again, regarding the openings in the skull, so this is again a very important thing. A patient presents with unilateral throbbing headache, photophobia, excessive lacrimation and hemifacial pain on teeth clenching. Which cranial nerve is involved? So here trigeminal nerve, as I've mentioned, is involved, and it is mainly the mandibular division which mediates the pain during teeth clenching, and symptoms align with trigeminal autonomic cephalalgia, and the cranial nerve 3 which controls the pupillary reflexes are normal here. So olfactory and optic do not mediate the facial pain. That's it. And now moving on to Neetpg 2021 PYQs. A patient presented with vision loss on radiological examination and aneurysm causing damage to optic chiasma was noted. Which of the following artery is most likely to be the artery that is causing the damage? So the answer is anterior communicating artery, because optic chiasma lies close to the circle of Willis and it is near to the anterior communicating artery. And the aneurysm, so anterior communicating artery, the most common cause of optic chiasma compression, and it leads to bitemporal hemianopia. Next question. A 34-year-old man presented with fever and massive splenomegaly. On palpation, spleen was 15 cm and directed obliquely when measured from the right iliac fossa. Which structure prevents the vertical and downward descent of spleen? So it is by the phrenicocholic ligament. It's a direct question and an important one as well. Next, identify the papillae from the given histological image. So this is an image of circumvallate papillae. Please go through the histological image of the other tongue papillae as well. Circumvallate papillae is the largest papillae which is found in the tongue, and it is found in the posterior tongue. Next, a 7-year-old boy was brought to hospital with multiple fractures of the humerus, secondary to fall from height. On examination, there is difficulty in flexion of the elbow and supination of forearm and associated loss of sensation over the lateral aspect of forearm. Which nerve is most likely to be injured? Answer is musculocutaneous nerve. So again, the nerve supply of upper limb, every time one question is coming, so please go through the nerve supply of upper limb and the muscles which get affected, the actions which get affected. Please go through them. Every year one question is there. Next, a patient presented with jaw swelling and weight loss. Suspecting a malignancy, the submandibular gland was resected. Most likely nerve to be damaged during submandibular gland resection. Answer is lingual nerve. This is a very direct question, and please don't make it a mistake in the exam. Most of the people will be getting it correct. Next, a patient underwent a coronary bypass graft with great saphenous vein. The patient now complains of paresthesia and sensory loss over the medial aspect of leg and foot. Which nerve is likely to be involved? So the answer is a saphenous nerve, because saphenous nerve accompanies the great saphenous vein and it supplies to the medial leg and the foot. So there is a chance of injury. Next, during clinical examination of nervous system, which nerve can be tested by touching? The uvula. So uvula is supplied by the glossopharyngeal nerve, which is the cranial nerve 9 for sensory functions. Now moving on to Neetpg 2020 PYQs, which of the following forms the lateral boundary of the anatomical snuff box? So anatomical snuff box, very important. Please learn about the boundaries of the anatomical snuff box. Lateral boundary is formed by the extensor pollicis brevis and abductor pollicis longus. Next, identify the cell marked in the image. So here it is the Purkinje cell, because they are flower-shaped cells and they are arranged in a single layer. Also, there are other cells like basket cells and Golgi cells, but usually they don't expect us to mark which type of cell from the histological image. But Purkinje cell, it's easier to identify, and usually this question keeps coming up. It's a PYQ. Next, which of the following is not used for identification of facial nerve trunk? Answer is inferior belly of Homo hyoid, because it is unrelated to facial nerve anatomy. The structures which are used for identifying the facial nerve are the tracheal pointer, posterior belly of digastric, and the retrograde dissection. Next, fourth false statement about fetal circulation. False statement about fetal circulation is, answer is anatomical closure of foramen ovale is 3 to 5 days. That is wrong. It closes in months to years. So the closure of foramen ovale, ductus venosus, ductus arteriosus, all of these are very, very important. Please go through them. Very important. Anatomical closure and their functional closure is also important. Please go through that. Next, a tumor of the uncinate process of the pancreas affects which of the following vessels? Answer is superior mesenteric artery, because uncinate process lies anterior to the SMA. Next, a patient presented with ataxia and incoordination. This is because of thrombosis of which artery? Answer is superior cerebellar artery, because it supplies the cerebellum. Thrombosis causes cerebellar dysfunction, leading to ataxia and incoordination and other features of cerebellar dysfunction. Question number 7. Which structure prevents upward extension of the thyroid swelling through its attachment to the thyroid cartilage? Answer is by the sternothyroid. Next question. A patient presented with the extension of MCP joint and flexion of IP joint. Which muscle is affected? Answer is interosseous and lumbricals are affected in this condition, and ulnar nerve injury paralyzes these muscles, leading to claw hand. Next, meiosis occurs in which part? Answer is adult ovary. Next one, a long left recurrent laryngeal nerve is because of the persistence of which arch artery? It is because of the persistence of the 6th arch artery. Next question, the muscle marked as red is innervated by? Answer is dorsal scapular nerve, because the muscle marked here is the levator scapulae, and it is supplied by dorsal scapular nerve. Also, the rhomboids are supplied by the same nerve. Next, a patient presented with right facial weakness, left leg pain and temperature loss. The lesion location is in lateral pons. It is seen in lateral pontine syndrome. The features of different syndromes and the vessels involved are mentioned in a table here. Please go through this. Very important. Next, ligation of common hepatic artery with impaired blood supply is seen in? Answer, right gastric and right gastroepiploic artery. The common hepatic artery gives rise to the right gastric and the gastroduodenal artery. The left gastric and the short gastric arteries arise from the celiac trunk and the splenic artery. So branches of the celiac trunk are very, very important, and how they further divide is also very, very important. Please go through them. Next, the type of joint. Type of joint, again a very, very important topic. Type of joint marked in the images. Answer, here it is synovial joint. The costotransverse joint is a synovial joint which is being marked here. So I've provided quite an important list of the joints. There are further more, but this one from this rapid revision video, I involved this one as a brief explanation. Please go through them. Synovial joints are seen in costovertebral, costotransverse and the interchondral joints, and primary cartilaginous joint, which is also known as synchondrosis, is seen in the costochondral, and secondary cartilaginous, which is also known as symphysis, is seen in manubriosternal and xiphisternal joint. Identify the sign shown here. This is Popeye sign. It's because of the rupture of the long head of biceps tendon. And Hill-Sachs sign is a bony defect in the humerus post-shoulder dislocation and is seen in radiological image, that is an X-ray image. Here I couldn't provide an X-ray image of that, but please go through the Hill-Sachs sign as well. It's a very important thing. Next, a patient presented with an enlarged inguinal lymph node. The most likely primary cause is? Answer, anal cancer, because lymph from the anal canal, which is distal to the dentate line, drains into the superficial inguinal lymph nodes. Identify the type of cartilage. Again a PYT here. This time they have asked about elastic cartilage. Previously it was about the fibrocartilage. So please go through the histological images of the types of cartilages. Now moving on to anatomy 2019 PYQs. The movement at dash joint permits a person to look to the right and left. It is at the atlantoaxial. Atlantoaxial joint allows rotational movement, and atlanto-occipital facilitates the nodding. Next one, all of the following are true about the right coronary artery except it gives rise to circumflex coronary branch, because that is the wrong statement. The right coronary artery arises from the anterior aortic sinus and it supplies the right part of the heart, and circumflex artery is a branch of the left coronary artery. So right coronary and its branches and the areas it supply, and the left coronary, its branches and the areas it supply is important. Please go through it diagrammatically as well. The diagram mentioning the supply and its branches is very important. Learning this from a diagram will help you more retain it in your mind. Next, what is the basis for the formation of omphalocele? Answer is physiological hernia which fails to go back. Next, which fiber is marked by the arrow in the image? Answer is projection, because internal capsule has projection fibers and the area marked here is the internal capsule. You can have better images as well. I've provided an image here, but please go through the internal capsule, the image and the cross sections of the brain, because a lot of questions, head and neck is a favorite area, and recently they have asked more questions from head and neck area. So please go through the images and basal ganglia and all those parts, the putamen, the neocortex, all this very important. Next, which nerve passes through the foramen marked in the image? Answer is inferior alveolar nerve. Next one, boundaries of Kellogg's triangle are formed by all except. Answer is gallbladder, because Kellogg's triangle is bounded by common hepatic artery, cystic duct and cystic artery. Gallbladder is not a part of the Kellogg's triangle. So here you can see there are two triangles, the hepatocystic triangle and the Kellogg's triangle. The inferior one, the lower one is the Kellogg's triangle, and the hepatocystic triangle lies above. The boundaries are almost similar, but this superior boundary varies in each of them, minor changes are there, so please go through them. Next, area marked in the given image is supplied by which dermatome? So umbilicus is supplied by T10 dermatome, and xiphoid process is supplied by T8, and T12 is the suprapubic region. Next, arrow in the image denotes which muscle? So again, upper limb nerve supply, the muscles and its actions are very important. So here it is asked about the extensor carpi radialis longus. Next one, which is the nerve supply of the structure marked in the image? So here you can see that the lumbricals are marked, and this is the second lumbrical which is given in green color. So second lumbrical is innervated by median nerve, and the medial two lumbricals are supplied by ulnar nerve. Next, nerve supply of the area marked in the image is by, answer is radial nerve, because the lateral forearm is supplied by the superficial branch of the radial nerve. Next question, cholecystrovena cavil line separates which structures? Answer is left and right lobe of the liver. The Cantline line, which is also known as the cholecystrovena cavil line, divides the liver into right and left lobes. Next, which of the following is false about skin? Answer is dermis is derived from ectoderm. It is wrong, because dermis is derived from mesoderm. Next question, all of the following structures are derived from the aponeurosis of external oblique muscle except linea semilunaris, because it is formed from the internal oblique aponeurosis. And inguinal canal and the related fascias and the muscles are very important. The boundaries, everything is very important, and the structures which develop from these muscles are also very aponeurosis are also very important. Please go through them. Next, which of the following lobes of prostate forms the uvula vesicae? So it is formed by the median lobe. It is a direct question and a repeat question also, quite a favorite topic. Next, food drop is caused by damage to? Answer is common peroneal nerve. So common peroneal nerve is quite a favorite topic, because in previous year, one more year, we had seen an question regarding the common peroneal nerve. Next, which of the following is true regarding decubant tenosynovitis? Answer is it affects the APL and the EPB, and the Finkelstein's test is the diagnostic test which is used. And next one, also the procedure for how to do a Finkelstein test also, please learn that, because sometimes an image of the Finkelstein's test can be given, and you can be asked to identify the condition or the muscles affected. Next, identify the structure marked with green color in the image below. So the structure marked is fornix and is a C-shaped bundle of fibers in the limbic system. Next one, first pharyngeal arch gives rise to all of the following except. Answer is levator paveli palatini. So the first arch, second arch, and I've mentioned the arches with the cartilages, muscles and the nerves related. Please go through them. Very important question. Now moving on to anatomy 2018 PYQs. Identify the thickened nerve in the image. Answer is greater auricular nerve, and it is a cutaneous nerve of the neck that supplies the skin over the parotid, auricle and angle of mandible. And leprosy often causes nerve thickening, and it affects the greater auricular and the transverse cervical nerves. Next one, Broca's area. So brain areas are important because different areas associated with speech, hearing, vision, all these are very very important brain areas. Please go through them. The numbers are also important. So Broca's area is situated in answer inferior frontal gyrus, and it has Brodmann's 44 and 45, and it is responsible for speech production. Wernicke's area is also important. Please go through its Brodmann numbers as well. Next, which of the following cranial nerve nuclei is not a part of the special visceral afferent column? This is a little tough area about the special visceral afferent, special somatic, all these general somatic, all these are very little difficult, but if possible, if you want to be in the toppers, then you need to know about this one as well. Answer is trochlear nerve. Next question, the joint between the attachment of 8th and 9th rib to the 7th rib is a synovial joint. Interchondral joints between 6th to 9th rib are synovial to allow the thoracic expansion because during respiration. Next question, which is the last fontanelle to close? So anterior fontanelle is the last one. It closes by 18 to 24 months. It is quite a general question, so most of the people will be getting this one as well correct. Don't if you don't know, please learn it now. It's a direct question, a direct answer, so please learn it. And even the type of joints is a very very important area of topic. It's a PYT, very important area. Previously also questions had come regarding the type of joints. So next one, which among the following is incorrect regarding Simpson's fascia? Answer is it is attached to the inner border of second rib. That's wrong. It is attached to the inner border of the first rib, and C7. Next one, the structure not passing through the aortic opening of the diaphragm. So the openings of the diaphragm, the vena cava opening, esophageal opening and the aortic opening, and the structures passing through each of these is again an important area. Please go through that. And so through the aortic opening, vagal trunk will not be passing. Next question. So I've mentioned the openings. One is at the T10 level, which is the vena cava opening. At the T8 level, at the T10 level, you'll be having the esophageal opening. At the T12 level, you'll be having the aortic opening. Next one, hat palate contains. Answer is keratinized epithelium, submucosa, and minor salivary glands. Next, what is the function of the muscle marked in green at the metacarpophalangeal joint? Answer is abduction, because the muscle marked here is the abductor pollicis brevis, and it abducts the thumb at the metacarpophalangeal joint. Next one, which among the following is the tensor of vocal cords? The vocal cord muscles, the tensors, abductors and adductors are very very important, and some of the muscles, they'll be acting at the vocal cords and some of the muscles will be acting at the laryngeal inlet. So that is also an important area, but the muscles acting on the vocal cords are very very important. Every time questions come from there. So here the answer is cricothyroid. Cricothyroid is again an important thing, because cricothyroid is the only muscle which has a different nerve supply. Find out what is the different nerve supply of cricothyroid when compared to the other muscles. So that's it guys for this video. And opening of larynx is by thyroepiglotticus, closing is by areoepiglotticus. I've mentioned a small chart to help you have a better idea. Next one, the nerve of the second brachial arch. So the brachial arch and the nerve supply, as I've mentioned in a table previously, please go through that table. The different arches and their nerve supply, the muscles, ligaments related. So here second brachial arch is related to facial nerve. Next one, which of the following statements is true about iliopubic tract? Answer is its fibers fan out with fascia iliaca laterally. That is true. Now, and iliopubic tract is a transversalis fascia thickening posterior to the Paupert's ligament, and laterally the fibers blend with fascia iliaca, and medially it inserts behind the conjoint tendon. Next, ureteric bud develops from. Answer is mesonephric duct, and the metanephros develops into nephrons. Next, the heart starts to beat in the 4th week of development. Very important and a direct question. Please don't get confused because these kind of questions, majority of the people will be making it correct. It's like a general question. So if at all you make this question wrong, then you will be out of the game. So that is where the PYQs are important, because if you miss out on a PYQ, then it will be difficult to get into the track, because PYQs, everyone will be going through it, and that is why I made this session where I'm providing PYQs free for you guys. Please make utilize of it, and I'll be providing the PDF in a very nominal price. Please try to keep the PDF as well, so that it will be easier for you to have the final recap just before 1 to 2 days before the exam, because watching a video 1 to 2 days before the exam is not a very feasible thing about each of the subject. But going through a book very easily, you can do it. You can just flip through the pages, but never ever miss out on a PYQ, because if you make a PYQ wrong, then that is going to affect your rank very badly. So that's it guys for this video, and since time is less, put your efforts more and make the best out of you. There might be sessions, 2 sessions, there might be many other problems coming up, but don't lose your focus. Keep the momentum until the last day and come out with flying colors. So till I come back with my new video, stay tuned. Till then, bye bye.